Do something for me right now. Swallow once. Just once. Notice what's sitting at the back of your throat. Is there a thickness there? A coating that won't clear no matter how many times you've already cleared it this morning? Now ask yourself something else. What if the real cause of that isn't your throat at all? What if it's something happening somewhere else in your body entirely, while you sleep, while you take your morning medication, while you go about a day that feels completely unremarkable? Here's what I want you to sit with for a second. You've probably been clearing your throat dozens of times a day for so long now that you can't even remember when it started. It crept in slowly. First it was mornings, then it followed you through the whole day, and at some point, without ever deciding to, you just accepted it as part of getting older. I need you to hear this clearly. That mucus is not random, and it is not simply your age catching up with you. Your body doesn't generate symptoms for no reason. Every persistent symptom is communication. The question is whether anyone has ever actually translated it for you, and in my experience, almost no one has. I'm Dr. Andrews. I've spent over 25 years in family and internal medicine, with a strong focus on geriatric and preventive care for adults over 60. I've sat across the table from thousands of patients in exactly this stage of life, and persistent throat mucus is one of the most consistently misunderstood symptoms I see. People get handed lozenges. They're told to drink more water. They're told it's just age. And the actual cause sitting quietly underneath it all is never named, let alone addressed. I started this channel because so much of what I'd tell a patient privately, the things that never fit into a rushed 15-minute visit, deserved a wider audience. Today I'm walking you through 5 specific research-supported causes of persistent throat mucus in adults over 55. And here's something most videos on this topic won't tell you. 2 of these 5 causes are very likely operating in your body at the same time right now, quietly reinforcing each other. By the end of this video, you'll know exactly which combination tends to show up together, and why that combination makes everything feel so much worse than any one cause alone. Before we go further, drop a comment and tell me this. Is your throat mucus worse first thing in the morning, or does it stay with you steadily all day long? Your answer actually tells me a great deal about what's likely driving this for you specifically. Just type morning or all day. I read every single comment. Let's start with one piece of biology almost nobody explains properly, because once you understand it, everything else on this list will make sense. Your body produces mucus constantly, every day, around the clock, and that is completely normal and completely healthy. Mucus is your airway's protective lining. It traps dust, bacteria, and viruses before they reach deeper into your lungs, and it keeps the delicate tissue of your throat moist and resilient. Mucus itself is not the problem. What changes as we age is how efficiently your body clears it. There's a system called mucociliary clearance. Your airways are lined with millions of microscopic hair-like structures called cilia, and their job, performed millions of times a day without you ever noticing, is to sweep mucus upward and out before it has a chance to accumulate. In a younger adult, this system works quickly and efficiently, but research has confirmed that as we age, those cilia slow down. They beat less frequently, and mucus that would have cleared in seconds at age 40 can sit and accumulate for hours at 65 or 70. What that means practically is this. Any factor that pushes your body toward producing a little more mucus will hit harder and last longer in your body than it would have decades ago. That's not a flaw in you. It's simply physiology, and it's the foundation everything else today builds on. Now, let's get into the 5 causes, starting with the one I want you to pay the closest attention to, because research consistently identifies it as the most frequently missed explanation for this exact symptom in your age group. It's called laryngopharyngeal reflux, LPR for short. Most people have never heard the term, so let's break it down in plain language. You're likely familiar with classic acid reflux, that burning sensation in the chest after a heavy meal. LPR is a quieter, more deceptive cousin of that. No chest burning, no obvious digestive discomfort, just a throat that won't settle. Here's the mechanism. At the junction where your esophagus meets your stomach, there's a muscular valve whose only job is to stay closed after eating, keeping stomach acid locked where it belongs. As we age, that valve can gradually lose tone, like a rubber band stretched one too many times. When it doesn't close completely, acid travels upward, not just into the esophagus, but all the way to the throat and voice box, sometimes even into the nasal passages. Here's the detail that makes this so significant. The tissue of your throat is far more sensitive to acid than your esophagus is. Even a microscopic trace reaching your throat triggers an immediate protective response. Your body produces thick mucus to coat and shield that irritated tissue. It's logical biology. But when this happens night after night while you sleep, you wake up to that familiar heaviness with no idea why, because there's no heartburn pointing you toward the real cause. Cleveland Clinic data notes that roughly 1 in 10 adults are affected by LPR, and more than half of people who see a specialist for chronic hoarseness turn out to have it. Up to half of LPR cases involve no heartburn whatsoever, just chronic throat clearing, a voice that sounds rough in the morning, and mucus that's already there the moment you wake up. Ask yourself honestly, is your throat noticeably worse in the morning than later in the day? Does it worsen when you bend forward? Has your voice sounded different right after waking? These are the fingerprints of silent reflux, and I'll give you a specific, practical plan for it later in this video. One important note here, and I want to be careful with this one. If you regularly take anti-inflammatory medications like ibuprofen or naproxen for joint pain, research has shown this class of medication can worsen reflux by reducing the stomach lining's natural protection. I'm not telling you to stop taking them. That's a decision between you and your doctor. But if your throat has been persistently bothered and you take these regularly, it's worth raising that specific connection at your next visit. The second cause tends to arrive quietly and goes unnoticed for exactly that reason. When most people picture a sinus problem, they imagine the dramatic version, throbbing facial pressure, a completely blocked nose, the kind of sinus infection you can't ignore. But in a large number of adults over 55, chronic sinus inflammation shows up almost invisibly. Breathing feels mostly normal, there's no real headache. And yet the sinuses, mildly inflamed and producing a bit more mucus than usual, are draining quietly down the back of the throat all day long. This is called post-nasal drip, and it's more tied to this age group than most people realize. A 2024 study on the condition found the average patient age to be exactly 55. Here's the frustrating part. Many people dealing with this have spent months buying antihistamines from the pharmacy, assuming it's seasonal allergies. The problem is that antihistamines dry the mucus temporarily without touching the underlying inflammation causing it, and dried, thickened mucus sitting at the back of your throat is often more uncomfortable than what you started with. The approach with the strongest evidence behind it is something simple and inexpensive: regular nasal rinsing with a warm saline solution. The European Position paper on rhinosinusitis, one of the most respected clinical guidelines in this field, recommends daily saline irrigation as a first-line treatment, backed by some of the strongest evidence available in medicine. A 2025 review in the journal Medicine confirmed that nasal irrigation is safe, effective, and low cost for reducing exactly this kind of chronic drainage. The key word here is consistency. 1 or 2 uses gives you 1 or 2 days of mild relief. Daily practice, done correctly, produces real, lasting improvement. I'll walk you through the exact method in the action plan. If this is resonating so far, type the number 2 in the comments so I know you're still with me. And if you haven't subscribed yet, this channel exists to keep giving you exactly this kind of information every week. The third cause is the one that tends to surprise people most because it's the one thing on their medication list they never thought to question. There's a class of blood pressure medications called ACE inhibitors, angiotensin-converting enzyme inhibitors. They're prescribed millions of times a year, they're effective, and for most people they're well tolerated. But they carry a recognized class-wide side effect. They allow a substance called bradykinin to build up in the body, and in a meaningful share of users, that buildup triggers persistent throat irritation and an ongoing urge to clear the throat. I want to be precise here. This is not an allergic reaction. It's simply how the medication works in a body that happens to be sensitive to that particular effect. Research published in the journal Chest reports this occurs in roughly 5 to 20% of users. A large study of over 27,000 patients found that adults over 65 had a 53% higher likelihood of experiencing this exact side effect compared to younger patients, which makes this especially relevant to you specifically. Here's the detail that causes the connection to get missed almost every time. This side effect can take weeks or even months to show up after starting the medication. So if you started a blood pressure prescription 8 months ago and your throat started bothering you 6 months ago, you may never have connected those two events. But that timing pattern is exactly what the research describes. To be clear, I'm not telling you to stop your blood pressure medication. That decision belongs entirely to you and your prescribing doctor. What I am telling you is this: if you take a blood pressure medication and you're not sure whether it's in this class, your pharmacist can tell you in under a minute. And if it is, there's an alternative category, ARBs, or angiotensin receptor blockers, that manage blood pressure equally well without this particular side effect. That's a conversation worth having at your next appointment. If you're still with me, type the word clarity in the comments, because that's exactly what today is meant to give you. The fourth cause surprises people for a different reason, not because it's complicated, but because it seems too obvious to matter: hydration. But stay with me, because the physiology here is more specific than a simple reminder to drink more water. Your mucus is mostly water, and its consistency, thin and easy to move, or thick and sticky, depends directly on how well hydrated the surrounding tissue is. Think of honey straight from the bottle versus honey that's been sitting open overnight. Same substance, completely different behavior depending on its environment. Your mucus behaves the same way. Here's the part specific to aging. Research has established that the thirst mechanism itself becomes less reliable as we get older. A younger adult feels thirsty well before they're meaningfully dehydrated. In older adults, that early warning system is blunted, which means you can be dehydrated enough to noticeably thicken your mucus without ever feeling particularly thirsty. Waiting for thirst as your cue means you're consistently behind. A commonly referenced target in clinical nutrition guidance is approximately 30 milliliters of fluid per kilogram of body weight daily from all sources. Water, herbal tea, soup, and water-rich foods all count. There's a second piece working alongside dehydration that almost never gets mentioned: the air around you. Dry, heated indoor air during colder months pulls moisture straight out of the lining of your throat, and your body compensates by thickening its mucus output. Wood smoke, strong cleaning fumes, scented candles, and dry air conditioning all create the same low-level, constant irritation. None of these are dramatic triggers. They're background noise, which is exactly why they're so often overlooked. If you've made it this far, type the number 4 in the comments. And before we move into the final cause, the one I genuinely think gets the least attention anywhere online, I want to remind you, this is the one most people watching have never heard connected to throat mucus at all. Stay with me. The fifth cause is the one I think gets the least attention anywhere in this space. And I consider that a real gap, because for a meaningful number of older adults dealing with persistent throat mucus, the root of the problem isn't in the throat, the sinuses, or even the stomach. It's in the gut. Here's what the research shows. Your digestive tract and your respiratory system share regulatory pathways through your immune system and your nervous system. The health of your gut microbiome, the trillions of bacteria living in your intestines, directly influences how reactive and inflamed your upper airways become. When that microbial balance is disrupted, a state researchers call dysbiosis, it can activate immune responses that promote excess mucus production in the airways. Not because anything is physically wrong with your throat, but because your gut is sending inflammatory signals your respiratory system is responding to. This connection is sometimes called the gut-lung axis, and it's an active, growing area of clinical research. Studies published in respected respiratory and immunology journals have confirmed that disruption in the gut microbiome can trigger immune responses that promote airway inflammation. And animal research has gone further, showing that gut microbiome changes alone, without any direct change to the airway itself, can measurably increase mucus production downstream. What disrupts the gut microbiome in older adults specifically? A diet low in fiber and fermented foods, repeated rounds of antibiotics over the years, high sugar intake, and chronic stress. None of these are exotic. They describe the daily reality of a very large share of people in this exact age group. You won't fix a gut-airway connection with a throat lozenge, but you can begin supporting it with consistent daily choices, which I'll include in the action plan. I promised you earlier that 2 of these 5 causes tend to show up together. Here it is. Silent reflux and gut microbiome disruption frequently travel as a pair, because the same chronic, low-level inflammation that weakens the valve protecting your throat from stomach acid is often connected to inflammatory signaling coming from an imbalanced gut. When both are present at once, the throat symptoms tend to feel more constant and more resistant to simple home remedies, which is exactly why addressing only one of the 2 so often leaves people disappointed. Before I give you the full action plan, I need a moment that matters more than anything else in this video. Most persistent throat mucus in older adults is benign, exactly what we've been discussing today, manageable and addressable. But your body sometimes uses a symptom to flag something that needs professional attention, not self-management. Please make an appointment with your doctor promptly if you notice any of the following: mucus that's consistently tinged with blood, even a small amount; difficulty swallowing that's gradually getting worse; unexplained weight loss alongside your throat symptoms; a lump or persistent swelling in your neck; or a significant voice change that isn't improving over time. These signs go beyond today's conversation. Please don't work around them. Bring them to your doctor directly. Now, the action plan. This is where everything we've covered becomes something you can actually use. Tonight, stop eating at least 3 hours before you lie down. When your stomach is still actively digesting and you recline, gravity works against the valve we talked about earlier, making it far easier for acid to travel upward. Raise the head of your bed using a firm wedge under the headboard legs or mattress, not extra pillows under your head, which just bends your neck. Even a few centimeters of incline uses gravity in your favor. Before bed, drink a full glass of warm water to support overnight hydration and keep your mucus thinner going into the morning. Tomorrow morning, before coffee, before breakfast, drink 1 to 2 glasses of plain warm water. This single habit costs nothing and immediately begins rehydrating your body and loosening overnight mucus buildup before it becomes your whole morning. This week, pick up a nasal rinsing device from your pharmacy, a neti pot or squeeze-style bottle. Use water that's been boiled and cooled to a comfortable warmth, not straight tap water. Add a small pinch of plain salt and optionally a very small pinch of bicarbonate of soda, which may help thin mucus by gently neutralizing nasal acidity. Use it once daily, ideally in the morning, and give it a full 2 weeks of consistent use before deciding whether it's helping. Also this week, book an appointment specifically to review your medication list against your throat symptoms. Bring a written timeline, when your symptoms started, and when you last started or changed any medication. If you take a blood pressure medication, ask directly whether it's an ACE inhibitor and whether an ARB might be appropriate for you instead. This month, begin supporting your gut-airway connection by adding 1 small daily serving of a fermented food: plain yogurt with live cultures, kefir, a small portion of kimchi or sauerkraut. This is a long-term strategy, not an overnight fix, but long-term strategies are the ones that actually shift your baseline over time. Many people notice modest improvement in throat comfort within the first 1 to 2 weeks of consistent hydration and nasal rinsing, with more noticeable compounding change by the 4-week mark as the gut and sinus pieces catch up. A quick word on the home remedies you've probably already tried. Honey is genuinely soothing for irritated throat tissue. It's not harmful, and it can calm symptoms temporarily, but it won't address any of the 5 causes we've covered today. Dairy doesn't create mucus from nothing. The science doesn't support that old claim. But some people do notice dairy makes existing mucus feel thicker, and if that's a consistent pattern for you, a 2 to 3 week reduction trial is reasonable. And if you've been adding sugar to warm tea for relief, you might want to reconsider. Sugar in warm drinks can actually pull moisture out of throat tissue through osmosis, working against the very thing you're trying to fix. Plain warm water or warm water with lemon is the better choice. Before we go, because I genuinely care about you watching this, Everything in this video is for educational purposes only, based on real research and real clinical experience. But I'm not your doctor, and this isn't personal medical advice. Your situation is unique, so please don't change any medication, diet, or health routine without talking to your own physician first. That conversation matters more than this video ever could. You deserve more than being told this is just age. You deserve a real explanation and a real plan. And today, you have both. Asking your doctor direct, specific questions isn't being difficult. It's exactly what an engaged, informed patient does. And you have every right to that conversation. If this video gave you something genuinely useful, hit subscribe and turn on the notification bell so you don't miss what's coming next. And consider sharing this with someone you love who's been quietly dealing with the same thing. A spouse, a sibling, someone managing care for a parent who's mentioned this exact symptom and been told to just live with it. That share cost nothing and might be exactly what they needed to hear today. Before you go, tell me in the comments, which of these 5 causes surprised you the most, and how long have you been dealing with this? I read every single comment, and your experience matters here. Take care of yourself, and I'll see you in the next one.